Elizabeth Ostrander spent the majority of the pandemic 2 years waiting for a lung transplant.
I was getting a little bit frustrated and just depressed about, not getting the match.
The wait is excruciating and can be extended for those with certain blood types.
If I have someone that is very sick and, for example, is an O blood type, and I get a B or A donor offer for transplantation, I cannot transplant that patient.
Dr. Marcelo Saipel and his team are trying to level the playing field. In a new experiment, the first of its kind, they say they've converted donor lungs with one blood type to a universal type.
Then patient in need of an organ transplant would have access to all the organs regardless of their blood type.
Blood type is determined by the presence of antigens on the surface of the red blood cells in our bodies. Type A has the A antigen, B has B, AB has both A and B, and type O, the universal blood type, has none. Saipel needed to clear any antigens from the organs, and Stephen Withers at the University of British Columbia had the perfect enzyme.
The enzymes themselves are ones that we discovered by hunting within the human gut microbiome, which in reality means in human feces.
Those enzymes were injected into one lung from a type A donor. The other was left untreated. Researchers then introduced type O blood to both, simulating what would happen when an organ is transplanted into a patient.
And what we could see is that these lungs did not present any signs of rejection.
Clinical trials are next. Elizabeth, who finally got her lung, by the way, is hopeful.
There'd be more transplants, more organs available.
Potentially breathing new life, experts say, into an unfair and outdated system. Jamie Mauracher, Global News, Toronto.